the vaccine uptake has slowed. I think it's been faster than many people thought it would be at the beginning of the year, right? But it's certainly not, I think, where we would like it to be. And I know that we've got enough vaccine. It's not as if the government has let us down and we haven't got supplies and things like that. The supplies are there, but it seems to me as if vaccine uptake is now slower. Is it all just hesitancy? Are we now pushing up against the anti-vaccine people, or are there other factors at play here?
In fact, it seems as though if you compare South Africa to many other countries, the real proportion of anti-vax is a small and dwindling number, fortunately.
Yeah.
And so those individuals who are absolutely, dead set against the vaccine may, in the next few months, become a single-digit percentage of the overall, adult population. But I do think on this one point, what we can do is, for those who are a little bit undecided, and there is a group that's undecided, is do exactly what you're doing, Graeme, which is share the information. Be absolutely transparent. Be honest. Tell them what we do know, tell them what we don't know, so that they can make an informed decision. In the next few hours, if not today, we will cross a very important threshold. 40% of all adult South Africans would have had a single dose. That's an enormous feat. Yeah. Yes, it's not 75% where we would like to be, but let's just pause for a second and look at 42 other countries on the continent, where most have hardly reached 5%, let alone 10%. And as you say, government has really done well to ensure that the freezers are full with vaccines. Whoever wants vaccines today can go to one of 3,000 sites across the country and get vaccinated. Also, the government has made it freely available at the point of service, and absolutely the medical aids and insurance have not only come to the party in terms of subsidizing the cost of those, but also providing the service provision around that. So I think that we have a lot to celebrate, firstly, and bearing in mind that this is the first of its kind adult vaccination program. It's actually a big deal. To have reached 40% in 6 months is a big deal. But your question around, there seems to be, a slowing of uptake, and you're on the button on that, Graeme. Across 5 surveys that were done in South Africa, it's fairly consistent that between 2/3 and 75% of individuals are in fact ready to take the vaccine. Those are well-designed surveys, robust, have decent sample sizes. But your question is a good one, which is, but then how come we only have 40% of adults, having taken a single shot, and obviously even lower if we look at fully vaccinated? Now, there's an intention action gap over there, which is quite significant, probably in the order of 25 or 30%. If you look at vulnerability, the poorer individuals are, it is likely the harder it is for them to get to a vaccination site. Today, we have a situation where even 5 kilometers for some individuals, the opportunity and transactional cost for somebody to go there is simply too high. And so, Graeme, let me give you a real kind of story. When we went out into the field, and one of the things that, again, the South African government must be praised for in partnership with the Solidarity Fund, is a very intentional and precise focus on taking vaccines to people, is to take away the barrier of expecting people to find their way there, expecting them to endure the cost of transport, expecting them to make arrangements for their children who may be at home, when we know that everybody's really struggling financially and otherwise. And so we listened to, an elderly lady standing in one of the grand queues where vaccines were set up at the SASSA queues. Makes so much sense. Go to where the people naturally congregate or meet or queue up for services. So whether it's the SASSA, whether it's the taxi rank, whether it's the retail store, where people are already going, when we ask the elderly people queuing for their social grant, where's the best place for you to be vaccinated? 78% of them told us, just here. It costs me nothing more, no more time, no more cost, and it's so convenient. And they shared with us the very real lived experiences of, if I'm only coming here to get 350 Rand as the COVID grant for the month, it's extremely hard for me to put away 80 Rand to take a taxi here and back, to give 50 Rand to a caregiver to look after my grandson while I'm there. Because that means half of my income for the month is gone. And so the more we can offset those user costs by either taking vaccines as close to people as possible, ideally outside their door, and potentially go door to door, or make it easy by going to where they are going, those outreach sites that we spoke about, that the Solidarity Fund is doing a wonderful job in funding, or as of 2 weeks ago, is offering a small incentive, 100 Rand voucher, especially for the elderly, especially for those who are struggling to do some grocery shopping, to get that done after the vaccination, is a small way that we can help individuals who are struggling with these barriers overcome those, so that as a nation we pull together. Because this is, as you started off, Graeme, this is not actually about us as the individual, but it's about how we as a collective come back to a normal state of functioning. And the best possible way to do that is for us to pull out all the stops and make sure that everyone that's struggling actually gets a fair opportunity at vaccination.
No, I agree. And I would just add one extra thing to what you've said there, that another place that we could help people to get vaccines would be in our places of work. I speak a lot to business communities and business leaders, and to say, it's not good enough to just say to your staff, and especially if you've got a labor force and you've got workers who maybe don't have the additional money and they don't have the flexibility of their schedules to take a morning out and go to a vaccine site, because they don't know how long they're going to have to wait. Luckily, they don't have to wait long, but people don't realize that these days. But as you say, even 50 Rand for a taxi for some people might be more than they can afford. So what business people can do is give vouchers, give a little bit of a pay for the taxi if that's the least you can do, give people some time off, or why not invite a nurse onto your site. I'm sure that it wouldn't take you more than half an hour to make a phone call and find out who's prepared to bring 100 vaccines onto your site. I'm not saying force anybody to do something they don't want to do, but give the opportunity. Just make it easy for people who might not find it as easy as you found it to get the vaccine.